The hearing will come to order. We have Pallone. I know, Mr. Pallone. I think you're Mr. Pallone. Good afternoon and welcome back to the Rules Committee. Today, the committee will consider H.R. 6, Substance Use Disorder Prevention, that promotes opioid recovery and treatment for patients and communities, the SUPPORT Act. H.R. 5797, Individuals in Medicaid Deserve Care That's Appropriate and Responsible in Its Delivery Act, and H.R. 6082, the Overdose Prevention and Patient Safety Act. H.R. 6, which we will discuss first, serves as the underlying vehicle for the majority of House-passed bills to combat the opioid epidemic. The bill assists in efforts to advance treatment and recovery initiatives, improve prevention, protect our communities, and bolster efforts to fight deadly illicit synthetic drugs like fentanyl. H.R. 5797, which we will discuss second, allows state Medicaid programs to remove the Institutions for Mental Diseases, IMD exclusion, for Medicaid beneficiaries aged 21 to 64 with an opioid use disorder. This will allow Americans with substance abuse disorders to get the full continuum of care necessary to treat their addiction. H.R. 6082, which we will discuss last, will permit substance abuse disorder treatment records to be shared between covered entities in accordance with HIPAA for purposes of treatment, payment, and healthcare operations. This will protect and treat substance abuse disorder patients precisely and effectively. I'd like to welcome our witnesses, and before we turn to them, ask Mr. McGovern if he has any opening comments.
Just a few. Thank you, Madam Chair. You know, although we disagree on some of the bills, Democrats support much of what you're trying to do to address the opiate epidemic. This is something that's killing 115 Americans every day, and that's why we've been pushing for action for a very, very long time. But we have to put this effort into context. Drug addiction is a pre-existing condition, and every day, Republicans are undermining the Affordable Care Act, including trying to decimate its protections for those with pre-existing conditions. The Trump Justice Department has said it will not defend the ACA. They have filed a brief encouraging the court to strike down the protections for pre-existing conditions. The administration no longer takes part in enrollment events in key states. It has cut funding for groups helping people enroll by 40%. It has slashed the budget for television advertisement by $90 million. And just today, the president moved to allow more bare-bones health care plans that undermine protections for pre-existing conditions. You are working hand in glove with this president. House Republicans passed a devastating ACA repeal bill last year. Had the Senate not saved us from it, that bill would have taken health care away from 23 million Americans. That includes those suffering from opiate addiction. And just today, conservative allies released another repeal bill that they are trying to have you take up this summer. Now, we know that Medicaid is a key driver in addressing opiate addiction. Thanks to its expansion in the ACA, there are 1.6 million more people with substance use disorders with access to health care across 31 states that expanded that program. But Republicans have tried to derail this expansion at every turn. You even passed a budget in October that cuts Medicaid by 30%. It never stops. And where is the long-term funding for what you're trying to do, Madam Chair? Republican leaders just canceled the markup for your labor HHS appropriations bill. That bill was flat funded. Solving this epidemic will take bills like this, but it will also take more money. It also requires us working together to improve our health care system. We'll never make meaningful progress if Republicans instead keep working to undermine the ACA and our health care system. It is time to stop politicizing health care in America. We are trying to work with you, and we support some of these bills. But when Republicans step up, when will Republicans step up and actually help us strengthen and improve on the protections of the Affordable Care Act? The sabotage must stop. So everything that we're doing here today, with the exception of one of the bills that's being brought before us today, I think you're going to see that the Democrats are going to be very, very supportive. But when you try to undermine the Affordable Care Act, when you try to take away the protections for pre-existing conditions, then this stuff doesn't mean very much. Substance abuse disorders are a pre-existing condition. Why would the administration go after this important protection? And why would Republicans be complicit in that effort? So anyway, I welcome our witnesses here today, but I think we have to put all this into context. What we're doing here, what we should be trying to do here is more than just a soundbite. We should be trying to actually solve this problem, make sure people who are suffering from these challenges have the health care that they need. And with that, I yield back.
The gentleman yields back. With that, I will turn to our witnesses. We have Mr. Walden, the chairman of the Energy and Commerce Committee from Oregon, Mr. Pallone, ranking member from New Jersey, and Ms. Cho, representing the Ways and Means Committee from California. All of our witnesses have had statements entered for the record, and would welcome now start with you, Mr. Walden, to begin to summarize. Thank you.
Thank you, Madam Chair. The House is in the midst of a 2-week effort to advance dozens of bills to combat the opioid crisis, as you know. I'm proud to be a co-author of H.R. 6, the Support for Patients and Communities Act, which includes several Medicaid, Medicare, and public health reforms to help combat the opioid crisis. H.R. 6 is composed of numerous bipartisan policies that were advanced through regular order by the House Energy and Commerce Committee and the House Ways and Means Committees. This bipartisan bill will help in our overall efforts to advance treatment and recovery initiatives, improve prevention, protect our communities, and bolster our efforts to fight deadly illicit synthetic drugs like fentanyl. H.R. 6 will also serve as the underlying vehicle for the majority of the House-passed bills to combat the opioid crisis to move over to the Senate. With nearly 20 different policies contained in the Support for Patients and Community Act, there are many initiatives and important ideas that are led by members of both sides of the aisle. The policies generally fall within one of a handful of categories. First, the bill contains policies that protect communities by improving our prevention and public health efforts. For example, the bill directs the Food and Drug Administration to issue or upgrade guidance on ways existing pathways can be used to bring novel, non-addictive treatments for pain and addiction to patients. Second, the bill also includes policies that improve access to treatment and accelerate recovery. H.R. 6 requires both Medicare and Medicaid to provide access to all forms of medication-assisted treatment and counseling. It also includes a policy to test state Medicaid models to expand substance abuse treatment and recovery services by targeting provider capacity challenges, and it makes the buprenorphine prescribing authority for physician assistants and nurse practitioners permanent. Third, the bill includes policies that fight the scourge of synthetic opioids, like fentanyl, by authorizing grants to state and local agencies for the establishment or operation of public health laboratories to detect fentanyl in its analogs and other synthetic opioids. And finally, we included policies that strengthen the role of Medicare and Medicaid as payers to ensure they have the tools necessary to combat the epidemic. H.R. 6 improves the ability of Medicare and Medicaid to assign beneficiaries with drug-seeking behavior to particular providers or pharmacies. It also includes provisions to ensure continuity of Medicaid coverage and treatment for juveniles and former foster youth. And to protect the most vulnerable among us, we improve drug monitoring in Medicaid programs by requiring Medicaid programs to have safety edits in place for opioid refills, monitor concurrent prescribing of opioids and certain other drugs, and monitor antipsychotic prescribing for children. This is neither our first step nor our last step to combating this epidemic. We know we'll have a lot more work to do as we legislate and evaluate going forward. But H.R. 6 is a very significant and bipartisan step forward to harnessing a range of tools and authorities across Medicaid and Medicare and public health programs to combat the opioid crisis. It's an important step toward curbing the flow of drugs that are taking the lives of more than 100 Americans every day. 1,000 will go into emergency rooms within this 24-hour period overdosing from opioids. We each know far too many family members, friends, neighbors who have been impacted by this crisis. So advancing H.R. 6 will literally save lives, and I encourage your support, and I yield back.
Thank you very much, Mr. Walden. And now Mr. Pallone from New Jersey is recognized.
Thank you, Madam Chairwoman. Can I just ask, I know that Chairman Walden talked only about H.R. 6. Is that what you want us to do now? Because I am in support of H.R. 6, but I'm opposed to the IMD bill and the privacy bill. Do you want me to cover all that now, or are you going to?
You can cover all three pieces of
All
legislation.
right, let me do that then. Well, that's what I was going to ask you. No, I don't want to come back. I love coming here, though. I wanted to echo what Mr. McGovern said about what's happening here in general. We had, I would say, months, really, of hearings on this opioid package. As you know, 20-something bills actually were on the suspension calendar last week. But I have expressed a lot of concern over the last 2 months in committee and on the floor about the same thing that Mr. McGovern mentioned, which is that ultimately what's important is that people have health insurance and that it be affordable. And if they don't, then they're not going to get treatment and they're not going to be able to deal with this opioid epidemic. So to the extent that the Republicans have tried to repeal the Affordable Care Act or sabotage the Affordable Care Act in the way that Mr. McGovern explained, that goes very much contrary to whatever positive impact there is going to be on this opioid package. And I do believe that a lot of hype, if you will, has been given to the opioid package by the Republican leadership and sort of lacking any real mention or significant mention of what's happening with the Affordable Care Act. And most notably, as Mr. McGovern said in the last few weeks, where the Justice Department under President Trump has decided not to defend the Affordable Care Act and the pre-existing conditions because having an opioid problem is a pre-existing condition. So I do want to say that. And I also believe that the package as a whole doesn't do enough for treatment, doesn't provide resources for treatment in a significant way. Now, the exception to that to some extent is H.R. 6, because we have worked with, I mean, the chairman has heard me complain about just what I've said for the last 2 months. And so we have made some progress there with H.R. 6. And I don't want to keep repeating what he said because my statement for the record, but it does address the treatment to some extent because it does, as he mentioned, provide for a lot more providers, physician assistants, nurse practitioners to dispense bupe for treatment. A lot of what Mr. Tonko had suggested in terms of Medicaid assisted treatment is included. The bill actually now includes methadone clinics under Medicaid, which is very important. And I'm not going to go through the list, but we did work on H.R. 6 to try to do things that I think would address treatment. And I'm not suggesting that this is really still doing the trick, because it's not. I do think that we still have major problems here and that we're not providing enough funding and addressing treatment sufficiently. But H.R. 6 does expand access and improve coverage in significant ways, and that's why I support it. Now, I wanted to mention the 2 bills that are coming up that I don't support, and why, briefly. One is the IMD Care Bill, and the problem with that is that right now, many states, I think about half the states, have gotten waivers where they have a whole continuum of care for someone who has has an opioid problem, okay? And the opioid problem requires a continuum of care. To just put someone in inpatient treatment or to prioritize inpatient treatment, in my opinion, is going to be counterproductive. And my concern is that if we had continued with those waivers instead of now prioritizing IMD, inpatient, I think we might have been a better job. And this is going to cost, I guess, about $1 billion. So now we have to offset that and pay for that. And my fear is that you start getting a situation where states put all the emphasis on the inpatient treatment and don't provide all the other services they would under the waivers that states are now getting. In addition to that, it's exclusively with regard to opiates and not all the other substance abuse disorders. And as you know, many people have a combination of all these things. They can't be looked at separately. And so I think that the bill actually is not helpful for that reason, and that's why I oppose it. The second thing, I'm trying to be brief. The second thing is with regard to H.R. 6082, I call this the privacy bill, if you will. This allows, other doctors or other healthcare professionals to share your treatment information without your permission. I think that is incredibly counterproductive because I think what happens is people won't show up for treatment because they'll be afraid that that they're going to be stigmatized or that they're going to lose their kid or something like that. I don't think we're sophisticated enough that people understand necessarily that people who need treatment should get it, and they shouldn't be stigmatized in the way oftentimes they traditionally were. And so I actually have an amendment before you that would maintain the privacy protections to individuals under Part 2 and would provide for a study so we better understand how this privacy issue works, because of my concern that by having those privacy protections essentially repealed, we're actually going to be counterproductive and make it so fewer people have treatment. So I oppose the bill for that reason, and I'll submit my complete statement for the record, Madam Chair.
Thank you very much. I commend the bipartisan approach to H.R. 6. I think that's very important. And we have several witnesses, including Ms. Walters from California, Mr. Mullen from Oklahoma, who will be testifying either immediately after this panel or after we recess on the other bills you mentioned, and look forward very much to that exchange and hearing more information about that, and invite you to come back again if you'd like to exchange views on those bills. I would note, speaking for Wyoming, one of the real challenges we have is people crossing state lines, coming into the state and getting prescriptions and having no ability for providers to track multiple prescriptions. And I know that trying to end that practice has been at the heart of a lot of what we're doing here today. So I think we have to make sure that we found a good balance between that and privacy. I believe these bills have done that. But I thank you very much for your comments, and would like to now recognize the gentlelady from California, Ms. Cho.
Good evening, Madam Chair and Ranking Member McGovern. Thank you for holding this meeting to discuss H.R. 6, legislation to help address the ongoing opioid crisis in our nation. This is an issue that impacts the health, social, and economic thread of all our communities. In 2016, there were 2,012 opioid-related overdose deaths in my state of California, and the number of heroin and synthetic opioid-related deaths has increased substantially. Certain regions of California have death rates approaching the highest in the country. Recently, 10 mostly rural counties in the state's extreme north had more opioid prescriptions than residents, a red flag for public health researchers. We've now seen a number of opioid bills in committee or on the floor. Unfortunately, very little has been done to expand treatment options or expand care. However, the Democrats were able to include a number of Democratic priorities in H.R. 6 to expand treatment options, including expanding Medicare coverage for opioid treatment programs. Currently, Medicare does not cover this sort of treatment. That would give Medicare beneficiaries access to a range of medication and behavioral treatment options, leading to more hope for long-term recovery. Opioid use disorders are rapidly growing among Medicare beneficiaries. Medicare Part D spending on opioids far outpaces enrollment, growing 165% from 2006 to 2015. In 13 states, the 65-plus population has the highest rate of opioid-related inpatient stays. H.R. 6 also expands coverage of medication-assisted treatments, as well as allows nurse practitioners and physician assistants to prescribe or dispense certain opioid treatment drugs. The measure also provides consistent Medicaid coverage for at-risk youth and expands Medicaid coverage for foster youth until age 26. While these bills are a step in the right direction, this is an epidemic that's not going to turn around overnight. It needs a thoughtful, long-term, sustainable approach. Part of that approach is to protect and strengthen the Medicaid and the Affordable Care Act. The ACA guarantees parity and non-discrimination for people who need substance use and mental health treatment. Thanks to the ACA, millions of previously uninsured patients now have access to health insurance. It also expands Medicaid, which is now the biggest payer for substance use disorder treatments. But instead of strengthening and ensuring a sustainable future for the program, Republicans are now using it to pay for the $2.3 trillion tax plan. Efforts to sabotage the ACA, coupled with premium hikes, slashing pre-existing conditions protections, and increasing drug prices, leads to more and more uncertainty for America's health care. If the current critical health benefits on which the middle class rely are taken away, it would reverse any progress to curb the opioid crisis and also increase health care costs and lower coverage and quality. Although we are taking steps today to address opioid use disorders, it's also important to remember that there are many other families devastated by the addiction to other substances. And the impact of the opioid crisis on the labor participation rate is just as concerning. According to the recent report, the economic burden from opioid misuse was estimated to be $95 billion. Madam Chair, the American people are facing uncertainty with their health care thanks to sabotage efforts by the current administration. On top of that, many of them are also trying to find a way out of one of the worst drug epidemics in our nation's history. Too many individuals, families, and communities are desperate for help, and we have the ability to provide it. Thank you, and I yield back.
The gentlelady yields back. I'd like to thank all of our witnesses. Mr. McGovern, do you have any questions?
Just briefly, because I know we have a few more witnesses here, and I know you have a meeting with the president coming up that should be interesting, so I want to make sure you're not late for that. But let me, Mr. Polite, again, I think it's important that we all kind of put these bills in context, and the fact of the matter is that there's a lot of good bipartisan work on these opiate bills, and I don't want to detract from that, but I just want people to understand, Mr. Pallone, what is, you know what the biggest payer for substance abuse disorder is?
Medicaid.
Right. Is there anything in any of these bills to expand Medicaid?
No, I mean, the problem, as you say, is that the administration continues to sabotage and try to cut the Medicaid program and the ACA.
And in the repeal effort, the so-called American Health Care Act that the Republicans put forward, was there anything in that bill that expanded Medicaid?
No, I mean, everything that we've seen from the GOP leadership in the House and from the president has been to cut back, and as you know, many states still have not expanded Medicaid, mostly red states.
So you're telling me that the first line of defense against substance use disorder is Medicaid, and yet the majority in this Congress tried to cut Medicaid by 30%, if I'm correct?
Exactly.
There's nothing to increase funding or expand Medicaid in any of these proposals?
No. The only thing,
as I mentioned at the opening, we're all aware of what the administration is trying to do, and I have a letter from the Attorney General basically cheering the courts on to be able to rip away some of these protections that people right now.
and when you talk about the associated health plans, remember, if you don't have an essential benefits package, the way the Affordable Care Act is outlined, and you allow trade associations or others to offer these junk plans, they may very easily exclude behavioral health and the drug treatment because it's very expensive.
And no matter what people think about the Affordable Care Act, we know that we know some of the protections that have been guaranteed to people that previously were not guaranteed to people. We've heard that from our constituents and from governors, the importance of making sure that people aren't disqualified for pre-existing conditions, making sure that people suffering from opiate addiction or substance use disorders are covered, that we get that. But I'm just, I'm worried about the impact of the administration's efforts on what we're all trying to do here in a bipartisan way, and that is deal with this opioid crisis. So is there anything in any of these bills that if the administration succeeds in basically taking away some of these protections, is there anything in these bills that would put them back in place?
No, I mean, you're talking about the basic idea of health insurance, right? Are you going to have health insurance at all, right? Problem is that many people may not, either because the individual mandate has been eliminated or because they don't get expanded Medicaid. Then the second thing is, if the essential benefits package goes out the window and they can offer junk plans, one of the first things that gets eliminated is opiate or other, drug treatment because it's very expensive. So, I mean, it's very possible that someone either has no health insurance at all or has no coverage for this.
I appreciate your answers. I don't want to belabor the point. I'm just, I just find it somewhat, telling that here we are, actually producing some bipartisan bills. Albeit some of them are I guess you oppose, but there's some bipartisan efforts here aimed at trying to combat this crisis, and then we have the administration, seeking to undermine everything we're doing. People who are battling with these issues need to have care, need to have insurance plans that cover these issues. And without that, I don't know what the hell we're doing here. So I thank the gentleman, and I yield back.
Thank you, Mr. McGovern. I appreciate never missing an opportunity to talk about a partisan matter when we've got bipartisan bills in front of us that I
try to
think
put it in context.
solve real problems. That's the chair is grateful for your efforts. Thank you.
How about we have help?
Mr. Yeah.
Thank you very much.
Mr. Hastings, do you have any
Madam Chair.
questions?
I told Mr. Walden earlier that I wasn't going to have a question, but I do have one question, and perhaps you and Mr. Pallone or Ms. Chu might answer it for me. I live in a state that did not expand Medicaid, and at the very same time, I live in a community. I represent Broward and Palm Beach County that are two of the larger areas in the country that have opioid crisis, and deaths are pretty much daily, particularly Delray Beach. That's proximately situated to where I live. How do I go forward in an area like that? What do I say to my constituents when the state has not expanded Medicaid and I have all of these problems ongoing?
Well, I mean, the problem you have is the middle-class person, right? In other words, who's fallen through the cracks? The person who's of very low income will be eligible for Medicaid. If you don't have expanded Medicaid, then the people that are above a certain level. Let me. My numbers may not be exact, but say like if you're below 20,000 in income, you're eligible for Medicaid. And let's say that if you're above 30 or 35 in annual income, you're eligible for some kind of help paying for your premium. Well, then the people that are getting help paying for the premium, assuming that it's enough of a subsidy or tax credit, they'll buy insurance and they'll have it. The people that are below the certain income of the 20 or whatever, they'll have coverage for Medicaid. The person who's in between, whose income isn't low enough for Medicaid, but isn't getting any help with the subsidy because they're at they're at 25 or 30 or whatever, they're the ones that fall through the cracks and get no coverage. And that's why you should expand Medicaid in your state. But, I know that you would, obviously.
Yeah, and of course, it's a state option. But let me address a couple of things. There were 1115 waivers that both administrations, the prior and this one, support for substance abuse treatment. And the extent to which you do qualify for Medicaid, there's expanded ability to get treatment under the legislation we're considering here. I would also say that in the Energy and Commerce Committee, two other things really important. One, we passed through 57 bills. There were, of which 54 of them, 55 of them probably came out of committee unanimously and were bipartisan and really good. We're going to save lives. We're going to change policy. We're going to get better prescribing. We're going to get better treatment options. And the other piece that especially involves Florida is we have an ongoing investigation through the Oversight Investigation Subcommittee looking at patient brokering, where it's an insidious practice. It is probably illegal. Right. And so part of the legislation we passed would also look at we want treatment facilities that actually treat people effectively. So we're trying to put in place standards for that. And so if you go back to 21st Century Cures legislation and CARA, in a bipartisan way, we as a Congress in the last administration put $1.2 billion in specifically at opioids. In the omnibus appropriation bill, some of us voted for, most of us voted for earlier this year, we added another $4 billion directed to states and programs to help those specifically with opioids. And then in this legislation is another $3 billion. So I think we should be proud as a Congress, Republicans and Democrats, in both the policy changes and the financial support going at this issue. Are there other healthcare issues we need to continue to work on and debate and improve upon? Absolutely. But on this one, we've both done the investigative work and the policy work that we should be proud of as a Congress, Republicans and Democrats, working together to save
appreciate that,
lives.
But I want to point out that if we want the people that know how to do this work to have opportunities that would be better, we would expand under Medicaid the number of beds that they might have, and that restriction of 16 is something that needs to be addressed.
Yeah, in fact, sir, if I might, we addressed that in the IMD bill that you're going to debate here and actually open the door for more treatment. Not in any way go back to the old warehousing people with mental illness. That's not it at all. But we have facilities. We need to lift that.
I won't belabor the point. I maybe wanted to save you all from having to go to the meeting. But
If I may address this,
yes, Ms. Chair.
Thank you, sir.
what you said about Florida reminded me that a sheriff from Florida called my office last week and thanked me because I had this bill that's going forth on best practices for sober living homes. But what's really startled me is that he said he saw 2 deaths a day in his city. So the crisis is very severe, and this is an ongoing issue. We know, of course, that if you're addicted, you're not going to exactly be having a middle-class job and having it very successfully. And therefore, these are people at the poverty level. How are they going to get treatment unless there is an expansion of Medicaid?
I thank you all. Thank you, Madam Chair.
Thank you, Mr. Hastings. And let me turn now to Mr. Brady, the Chairman of the Ways and Means Committee. Just remind the panel, we have a hard stop in about 3 minutes. So not to rush you at all, Mr. Chairman, if you'd like to return later. But let me turn things over to you now for your statement.
Thank you, Chairman Shane, Ranking Member McGovern, and others. I'll submit my statement for the open record. I do strongly support the Support for Patients Community Act. It includes 2 provisions from the Ways and Means Committee that was done in a very bipartisan way. One of them is to make sure that prevents people from abusing the system who are obtaining opioids from multiple doctors and pharmacists, and instead just locks them into one for each. These are seniors in Medicare, and we have a surprising number of them who have opioid problems. So this is creates, it's called the Part D lock-in, but it creates protections for the consumer, for the physician, for the pharmacist, but solves the problem. The second provision is a policy to expand access to more holistic treatment for addiction through the use of medication-assisted treatment. We strongly support this bill, and we're available for questions.
Thank you, Mr. Chairman. Are there any further questions? Then the committee will dismiss this panel and will stand in recess, subject to the call of the chair.
I'll ask, I'll email Catalina now and ask her if she got that.
Awesome, thank you so much. Do you need water or anything?
Oh, sure.
Cup? Is the cup okay?
Yeah. Oh, yeah, that's fine.
Yep.
Thanks. I'll let you know when I hear back from her.
Okay, thanks, appreciate it. If not, we'll call their office when we're busy.
Okay.
Yeah, hopefully it won't be too long, but
So I'm moving this evening.
trouble. Little kinky schedule.
A little pink, yes.
What can you do? It's president, so.
Yeah. Test 1, 2, 3. Hey, how are
How's
you?
it going?
Good.
Just before I walked in, right? Yeah, that's right. I've never sat in one of these cushy chairs before. This is kind of nice. This is what happens when you're a single. Is this cigars? Wasting a perfectly good humidor. Yes. I'm sorry? Yeah. Care, I mean, thank you. Yes.
Do you know if we're all going together?
I think, I heard
I
that
hope
you and I were, I didn't hear
I
any
hope
other
so.
names.
I
but,
just, I gotta get out of here.
Check your cushy seat. I'd probably bump some senior, but not you.
Not me.
You sure I can hear the members of the committee? Oh, you have fallen, the mighty have fallen.
I was very good, wasn't I good? And I'm gonna be, especially good because it's my wife's birthday and, she wants to go to this Library of Congress thing. Soon, so.
Okay, so maybe we can get this done quickly. I'm all in. No questions, awesome. We'll be quick.
That's a good idea.
I'll answer all the objections in my opening.
That'd be good. I'd like to go over to the.
Hey, how are you doing? Good.
Rules Committee to come to order, and thank you very much for joining us at the votes on the floor. I'm delighted to see that we have a number of members that are making themselves available to come to the Rules Committee for the purpose of speaking. I believe, and I recognize we've got several bills that are very close to each other, but H.R. 6, the substance use disorder prevention that promotes opioid recovery and treatment for patients in Communities Act. It is my belief that the principals have spoken on this effort, and we would now move directly to those people that would have amendments, with the knowledge that the Ways and Means discussion has not yet occurred, and we will move forth. So we will first move to the distinguished gentleman from Texas, Mr. Barton. And before we move any further, without objection, anything you brought in writing will be entered in the record without objection. I want to thank our awesome stenographer who's here this evening. The gentleman is recognized.
Thank you, Mr. Chairman, and thanks to members of the committee. I have a bipartisan amendment that has been approved by Chairman Walden, and I believe it's also been approved by the ranking member, Mr. Pallone, as bipartisan co-sponsorship. Congresswoman Annie Custer of New Hampshire, and also myself and Mark Meadows of North Carolina. It's a simple amendment, and it sets some guidelines for prescribing opioids, and requires a report by the FDA to develop those guidelines, and I would ask that it be made in order.
Thank you very much. The gentlewoman from California.
Thank you, Mr. Chairman. Tragically, the opioid epidemic claims the lives of 115 Americans each day. This scourge affects Americans of every color and creed, every community and state, and every political party. Countless individuals need to help and addiction treatment services before opioid abuse leads to overdose and death. While many of these patients may benefit from outpatient interventions, others need highly specialized inpatient treatment. I introduced H.R. 5797, the IMD CARE Act, to increase access to care for Medicaid beneficiaries with opioid use disorder who need the most intense care possible, inpatient care. Under this bill, states would have the ability to provide care for these Medicaid patients in an institution for mental disease, commonly known as IMD. An IMD is a hospital, nursing facility, or other institution of more than 16 beds that is primarily engaged in providing diagnosis, treatment, or care of persons with mental disease and opioid use disorders. The IMD CARE Act would allow states to repeal the IMD exclusion for 5 years for adult Medicaid beneficiaries who have an opioid use disorder. These beneficiaries would receive treatment in an IMD for up to 30 days, during which the time the beneficiary would be continually assessed to ensure their treatment and health needs require sustained inpatient care. The bill would also require the IMD to develop an outpatient plan for the individual's next steps in treatment. Medicaid would be able to cover these inpatient services as state plan option for a 5-year period starting October 1st, 2018. Throughout the Energy and Commerce Committee's work on the opioid crisis, the IMD exclusion is consistently identified as a significant barrier to care for Medicaid patients. Not every patient needs treatment in an IMD, but those who do are often among the most vulnerable. Unfortunately, current federal law prohibits Medicaid beneficiaries ages 21 to 64 from receiving care in an IMD. What once was a well-intended exclusion on federal Medicaid spending now prevents individuals from seeking treatment. In the light of the opioid epidemic, I believe my legislation strikes the right balance. I know some have suggested that states continue to seek CMS waivers to allow Medicaid to pay for IMD care. Waivers can be a good option for some states, but not all states want a waiver. In fact, less than half the states have applied for a waiver. Additionally, a waiver can take a substantial amount of time to develop, review, and approve. We are losing too many friends and family members to force states to navigate a lengthy and uncertain waiver process. The IMD CARE Act allows states to act now to ensure patients who are suffering from addiction get the care they need. The National Governors Association and the American Hospital Association have endorsed this legislation. And as you know, the repeal of the IMD exclusion would increase mandatory outlays and add costs to the Medicaid system. My amendment also pays for this expenditure by curbing unnecessary federal and state Medicaid outlays. The amendment includes an offsetting policy that encourages states providing Medicaid benefits through managed care organizations to adopt a medical loss ratio at 85%. Since Medicaid is financed by federal and state governments, the rebate for costs exceeding 85% would help reduce federal and state Medicaid spending. I want to thank Chairman Walden for his support of this bill that would provide much-needed care to many Americans who are suffering from opioid use disorder. Through IMD CARE Act, Congress has a unique chance to remove a barrier to care and help bring specialized treatment to Medicaid patients who desperately need it. Thank you.
I want to thank the gentleman very much. I note that the gentleman, Mr. Mullen, is here, and I had shown that he was going to be speaking on H.R. 6082 as opposed to H.R. 6. So the objection, I'm going to allow him to speak also on any amendment or anything he'd like to speak about. The distinguished gentleman from Oklahoma is recognized.
Sir, you want me to talk about the 6082
Whichever
now?
you'd like to do. I see that I have you down
Yes,
as
sir.
a speaker for H.R. 6082. I do not see you down necessarily under this bill, but the gentleman, if he'll specify his amendment, the gentleman be recognized.
Thank you. This is about H.R. 6082, that is a bipartisan bill. Congressman Blumenauer is my lead co-sponsor.
That's correct.
We have several people on opposite sides of the aisle, on opposite sides of the issue that's supporting this. This deals with Part 2 in HIPAA, which is Part 2 is basically CFR 42, Part 2, which is referred to specifically as Part 2. It deals with the HIPAA law and privacy laws. What our bill does is essentially it aligns Part 2 with HIPAA and puts everybody underneath one category so the doctors can see your entire record when they're treating you. The issues that we have right now is individuals with tendency to misuse drugs or have been treated for addiction issues, and those that had been treated for mental illness. Doctors, when they're treating the patient, cannot see their records unless the patient gives them permission to do that. It is separate from HIPAA, which is very difficult for doctors to treat when they're prescribing medication that could have reverse effects to them. When they're in an emergency care situation to which the patient can't consent to them seeing it, the doctor has no way to access it or no reason to access it. They can get a waiver to access it, but it's difficult for them to do that. So what we're simply doing is taking Part 2, putting it up underneath the HIPAA rules. One thing I do want to point out, underneath Part 2, there's been no cases ever prosecuted underneath Part 2, zero. The Department of Justice said it's not worth their time because for violating it, it's a $50 fine. That's it. Underneath HIPAA, it can range from $100 to $50,000 up to a maximum of $1.5 million per year, and there's been 173 cases that have been tried underneath HIPAA. So SAMHSA has asked us to look at this. They have wrote up a statement in support of aligning Part 2 with HIPAA, saying the practice of requiring substance use disorder information to be any more private than information regarding other chronic illnesses such as cancer or heart disease may itself be stigmatizing. Patients with substance use disorder seeking treatment for any condition has a right to healthcare providers who can fully be equipped with seeing all their information needed to provide the highest quality of care. While there's been some opposition, this is widely supported from industry, from every area, much less it is bipartisan. With that, I'll yield back and be happy to take on any questions that the panel might have.
Thank you very much. I appreciate the gentleman not only appearing, but his discussion of this in relationship to the distinguished gentleman from Oregon, Mr. Blumenauer. Thank you very much. Mr. Dunn, you're now recognized.
Thank you, Mr. Chairman and Ranking Member McGovern. I'm testifying today on behalf of my amendment to H.R. 6. I'm grateful to the committee for the opportunity to testify this evening. I'm also grateful to my amendment co-sponsors, all of whom are physicians, Drs. Rowe, Harris, and Marshall. Mr. Chairman, let me be clear at the outset that in large part H.R. 6 is a great bill. My amendment to H.R. 6 would remove language which would allow nurse specialists, nurse midwives, and nurse anesthetists to prescribe buprenorphine to 100 patients immediately for 5 years. This represents a significant and possibly rash expansion of prescribing authority for healthcare providers, included in the bipartisan Comprehensive Addiction Recovery Act of 2016. The creation of this expanded authority for non-physicians to prescribe buprenorphine a highly controlled and addictive and dangerous opioid opens up new potential for opioid misuse and abuse. This result is, I believe, the opposite of the overall intentions of H.R. 6. Buprenorphine was first introduced in Finland in 1997, and it is now the most widely abused opioid in that country. It accounts for more deaths by overdose than any other opioid. 60% of patients in opioid substitution treatment use buprenorphine. 40% use methadone. In 2015, the General Mortality Register indicated that buprenorphine, usually in combination with alcohol or medication such as Xanax, was involved in the majority of drug-related deaths in Finland. The United States should take notice of Finland's experience with the addictive nature of this narcotic and the dangers of a carte blanche authority to prescribe buprenorphine. Let me be clear, buprenorphine is an opioid, and it is a bridge to comprehensive treating of substance abuse disorder. And it should be prescribed by those with the appropriate clinical training and comprehensive understanding of substance abuse disorder. Individuals who run these medically assisted treatment centers can access these healthcare providers and do currently access these healthcare providers who have the knowledge and experience to prescribe buprenorphine. Congress should be looking at proliferation of opioids under these provisions with an objective lens and weigh the risks and consequences of creating more opportunity for individuals to obtain this drug. In effect, we are responding to an opioid crisis by making a new and dangerous opioid more available from many new sources and new prescribers who have less experience. As a physician, I've seen too many patients suffer in the grips of substance abuse, and I'm thankful that the opioid epidemic is beginning to be addressed in a comprehensive fashion by Congress. However, we should proceed with caution in giving people more access to opioids from caregivers who are not subject to the clinical training or the epidemiological background knowledge required to treat substance abuse disorders. I would note that an early American experience with allowing more non-physicians to prescribe opioids is unfolding in New Hampshire as we speak. In New Hampshire, physicians are no longer the top prescribers of opioids. Nurse practitioners and PAs prescribe more opioids in New Hampshire than physicians do. I urge the committee to support my amendment. I thank you very graciously for your time, and I yield back.
Dr. Dunn, thank you very much. The distinguished gentleman from Ennis, Texas had asked, and I delayed him from previously giving his testimony, and I would like to ask if the committee has any questions for the gentleman, Mr. Barton, as he has an event that he has been asked to attend. Mr. Barton, I want to thank you for taking time to be with us. The committee will respectfully not only review your request, but want to thank you very much for your time to come present your ideas to the committee. And the gentleman would be allowed to leave as we had discussed earlier, that I would attempt to make that time available to the distinguished gentleman. Thank you very much, sir. Yes, sir. Mr. Dunn, you are bringing forth perhaps one of the most important issues, I think, about this process. What does the bill speak to? You're wanting to make sure that you limit those people that would be allowed to offer a prescription for narcotics under this bill. Does the bill openly allow, for instance, like I'd heard midwives and other people that might not be trained as highly refined as a medical doctor to still be in this prescription business?
It actually does, Mr. Chairman. So you have people who I'm unaware of any state that allows them these three categories to prescribe as to outpatients controlled Schedule II medications. Now, PAs and ARMPs, they have it in many states, almost all. They are fine. Let that go by. But the nurse midwives in some states, a nurse midwife is the only credential is they observe a few births. And to give them prescribing authority to a powerful new narcotic, an opioid that is clearly causing havoc on the other side of the Atlantic, and allow that to be a new source of opioids in America, I think is counterthetical to to the gist of H.R. 6.
The committee evidently allowed this in the bill or didn't address it. I'm sure the distinguished gentleman from Louisville, Texas, will be able to update the committee when it comes appropriate time to discuss this. But I'm inclined to not only allow your amendment to be in order, but to vote for it, seemingly that it would offer some bit of common sense from a physician's perspective to say, this has become a national nightmare. This has become essentially a product, because of how large it is, that we should tighten our grip on it, not allow it to perhaps be used in other ways that might not be as tight, meaning prescriptions offered by not just medical doctors, but which is important, but really we might want to refine it further to be specialists within medicine. Would not surprise me if we attempt to do that, but this seems to be going the right direction. I want to thank you very much for being here. The distinguished gentleman, as you know, is an Eagle Scout. I know is an Eagle Scout, and I want to thank you also for representing the Boy Scouts of America and the highest award that the Boy Scouts offer. You lived up to that today, and I want to thank the gentleman very much.
Thank you, Mr. Chairman.
Chairman Cole.
Thank you, Mr. Chairman. I just want to quickly thank my colleague for his contribution in this debate and what he's doing, frankly, to what's a real scourge in our state. We've had a lot of people that have inadvertently found themselves addicted, not meaning to be, and frankly, almost innocent victims of the process. I want to thank all of you for what you're doing. We sometimes get caught up, and we certainly have differences up here, and there's a lot of spirited debate over a lot of issues, and that's all fine. But I've actually been very proud of Congress in a very bipartisan way for coming together on a crisis that's facing the American people. And all of you have reached across the aisle and met with considerable success in that. And so, again, while there's always concerns and differences, and I respect that, it's part of Congress people don't see enough, and it's the part that probably gets the most done. So I just want to thank all three of you for your contributions. But since I'm Oklahoman, I got a favorite on the panel. And since I'm Native American, he's a real favorite. Now, if he was just Chickasaw instead of Cherokee, he would be spectacular, but he's still pretty good. So proud of him. Yield back.
Well, I'll verify that also, and as we acknowledged here, thanks to your co-sponsor, the gentleman, Mr. Blumenauer, also, and for you to come up and take time with us speaks volumes about your commitment to that. Mr. McGovern?
Thank you for being here. I have no questions.
Does anybody else have any questions on this side? Dr. Burgess?
Yeah, I want to thank Dr. Dunn for bringing this amendment to the committee rules, and Chairman Sessions is right. This was controversial when it was heard at the subcommittee and the full committee. It was actually not resolved as we concluded our business those nights of the markup. Mr. Dunn is correct in his identification of what remains an unresolved problem, and I think he has tackled it in the appropriate way and obviously very thoroughly researched and well thought out. So I thank you for bringing the amendment, and I recommend it be made in order. I yield back.
The gentleman yields back. Any other questions? Great. Well, thank you very much to our panel. I appreciate it, and we'll dismiss this panel, and I think bring up the gentlelady from California, Ms. Waters.
Thank you very much, Madam Chair Lady and members of the committee and Ranking Member McGovern. I have 3 amendments that I would like to have made in order. The first amendment is number 19, Survey on Unmet Substance Abuse Treatment Needs. H.R. 6 is drafted, includes many positive provisions, and extends important and well-intentioned legislative efforts to address the opioid crisis in this country. That said, as we all know, in the United States, people suffer from a range of substance abuse issues. Likewise, there are a range of entities that provide different types of substance abuse treatment services. The purpose of my amendment is to ensure that we have a clear understanding of the substance abuse treatment services available, the communities and the populations that are being served, the types of substance abuse issues being addressed, and any unmet needs or inadequacies in the way we're addressing substance abuse issues. My amendment would direct that the Department of Health and Human Services conduct a nationwide survey of entities that provide substance use disorder treatment services. Based on the results of that survey, my amendment directs HHS to develop and submit to Congress a plan to direct appropriate resources in order to address inadequacies in services or funding identified through the survey. The survey called for me by my amendment is intended to complement existing efforts by the Substance Abuse and Mental Health Services Administration, that is SAMHSA, to examine substance abuse treatment services in order to develop a concrete plan to address unmet needs. So shall I continue with the other amendments, or do we want to take them one by one?
No, you can go ahead with all three. Thank you.
Okay. The next amendment is an amendment just one moment. Okay, I've come here today to request that the Rules Committee allow me to offer one amendment to H.R. 6 and two amendments, of course, to H.R. 5797 and waive all points of order against each of these three amendments. As you may know, H.R. 5797 allows states to use Medicaid funds to treat adult patients ages 21 to 64 with opioid abuse disorders in institutions for mental disease with more than 16 beds. While expanding access to treatment for substance abuse disorders is an admirable goal, several concerns have been raised regarding the approach in H.R. 5797. My two amendments are designed to address some of these concerns. Number 10, Waters number 10, one obvious limitation of H.R. 5797 is that it only applies to opioid disorders. It does nothing to expand access to treatment for other types of substance abuse disorders, including alcoholism and the abuse of illegal drugs like methamphetamine, crack, and other forms of cocaine. My first amendment, that is, Waters 10, expands the option for states to use Medicaid funds for treatment in IMD facilities to include treatment for all types of substance abuse disorders rather than only treatment for opioid abuse disorders. Number 9, a second problem with this bill is that it only expands access to treatment in inpatient IMD facilities. It does not provide Medicaid funding for substance abuse treatment services in an outpatient setting, nor does it require states to make such services available. Not all substance abuse patients need to be treated in an institution, and those that do will also need outpatient recovery services after their release from an IMD. One way for states to expand access to substance abuse treatment services is to expand Medicaid under the Affordable Care Act. Medicaid expansion would ensure that all low-income people, including those with substance abuse disorders, are able to obtain treatment for their medical conditions. And then the other amendment requires states to expand Medicaid pursuant to the Affordable Care Act as a condition for using Medicaid funds to treat people with opioid abuse disorders in IMD facilities. This amendment provides an additional incentive for states to expand Medicaid, which will in turn expand access to a broad range of treatment and services for patients with substance abuse disorders. So expanding access to Medicaid will benefit patients with substance abuse disorders, regardless of the type of addiction from which they suffer, and regardless of whether they would be best served by an inpatient treatment, outpatient treatment, or a combination of the two. So I would thank the Rules Committee for considering my amendments and respectfully request that you allow me to offer them on the House floor. With that, I yield back.
Thank you. I thank the gentlelady. Are there any questions?
Just wanted to say we support making her amendments in order.
Thank you. Mr. Hastings?
I think they're critical amendments, and particularly the last two that Ms. Waters brought to our attention, and I support them being made in order.
Thank you. All right, well, thank you very much, gentlelady from California. I appreciate your efforts on this issue that is a bipartisan issue and is hugely important to all of us. So thank you for appearing before the Rules Committee. And this closes the hearing portion for H.R. 6, H.R. 5797, and H.R. 6082, and the committee stands in recess, subject to the call of the chair.
Yes, he's going to take it. Were you ready? Well, wait. Rules Committee, come back to order, and thank you very much. We will now move forth after taking a quick break, and the chairman will be in receipt of a motion from the distinguished gentleman from the great state of Georgia.
Thank you, Mr. Chairman. Mr. Chairman, I move the committee grant H.R. 6, the Substance Use Disorder Prevention and promotes opioid recovery and treatment for patients and communities Act, a structured rule. The rule provides 1 hour of general debate equally divided and controlled by the chair and ranking minority member of the Committee on Energy and Commerce. The rule waives all points of order against consideration of the bill. The rule provides that an amendment in the nature of a substitute consisting of the text of Rules Committee Print 115-76 is modified by Rules Committee Print 115-78, and the amendment printed in Part A of the Rules Committee report shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against provisions of the bill as amended. The rule makes in order only those further amendments printed in Part B of the report. Each such amendment may be offered only in the order printed in the report, may be offered only by a member designated in the report, shall be considered as read, shall be debatable for the time specified in the report, equally divided and controlled by the proponent and opponent, shall not be subject to amendment, and shall not be subject to a demand for division of the question. The rule waives all points of order against the amendments printed in Part B of the report. The rule provides one motion to recommit with or without instructions. Section 2 of the rule grants H.R. 5797, the Individuals in Medicaid Deserve Care that is Appropriate and Responsible in its Delivery Act, a structured rule. The rule provides 1 hour of general debate equally divided and controlled by the chair and ranking minority member of the Committee on Energy and Commerce. The rule waives all points of order against consideration of the bill. The rule provides that the amendment in the nature of a substitute recommended by the Committee on Energy and Commerce, now printed in the bill, modified by the amendment printed in Part C of the Rules Committee report, shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against provisions of the bill as amended. The rule makes in order only those further amendments printed in Part D of the report. Each such amendment may be offered only in the order printed in the report, may be offered only by a member designated in the report, may be considered as shall be considered as read, shall be debatable for the time specified in the report, equally divided and controlled by the proponent and an opponent, shall not be subject to amendment, and shall not be subject to a demand for the division of the question. The rule waives all points of order against the amendments printed in Part D of the report. The rule provides one motion to recommit with or without instructions. Section 3 of the rule grants H.R. 6082, the Overdose Prevention and Patient Safety Act, a closed rule. The rule waives all points of order against consideration of the bill. The rule provides that an amendment in the nature of a substitute consisting of the text of Rules Committee Print 115-75 shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against provisions in the bill as amended. The rule provides one motion to recommit with or without instructions. Finally, the rule directs the clerk to, in the engrossment of H.R. 6, add the text of H.R. 2851, H.R. 5735, and H.R. 5797 as passed by the House as a new matter at the end of H.R. 6, and make technical and conforming modifications in the engrossment.
You've heard the motion from the distinguished gentleman from Georgia. I would yield myself 1 minute. This is for the explanation of this rule. It is one rule, 3 bills, H.R. 6, structured rule with 1 hour debate by Energy and Commerce, provides for the adoption of the unwrapped wraparound amendment contained in the Rules Committee Print 115-78, modified amendment number 23, offered by the distinguished gentleman from Hood River, Oregon, Chairman Greg Walden of the Energy and Commerce Committee. Makes in order 8 amendments, 3 Republicans, 2 Democrats, and 4 bipartisan. Motion recommit. H.R. 2851, H.R. 5735, and H.R. 5975 included. H.R. 5797 is the CARE Act, structured rule, 1 hour debate, Energy and Commerce, provide for adoption of amendment number 2 offered by Representative Walters, who gave testimony today, makes in order 4 amendments, 1 Republican, 2 Democrats. I don't know how we added up 4, but that's 3. Motion to recommit, H.R. 6082, overdose, abuse, and prevention, closed rule, 1 hour debate, to Energy and Commerce. Motion to recommit. Is there an amendment or discussion to that? Distinguished gentleman from Massachusetts.
I have an amendment to the rule. I move the committee make an order and give the necessary waivers for the amendment offered by Representative Kennedy to H.R. 5797, number 7, which expands the eligible population for this bill to individuals with all substance use disorders so that states can provide the full continuum of care.
Thank you very much. Discussion? Those in favor of the McGovern amendment, signify by saying aye.
Aye.
Those opposed, no. No. Those have it.
As for roll call?
Gentlemen, that's a roll call vote. Clerk will poll the committee.
Mr. Cole, Mr. Woodall. No. Mr. Woodall, no. Mr. Burgess. Mr. Burgess, no. Mr. Collins, Mr. Byrne. Mr. Byrne, no. Mr. Newhouse. Mr. Newhouse, no. Mr. Buck. No. Mr. Buck, no. Ms. Cheney. Ms. Cheney, no. Mr. McGovern.
Aye.
Mr. McGovern, aye. Mr. Hastings.
Aye.
Mr. Hastings, aye. Mr. Polis, Mrs. Torres. Mrs. Torres, aye. Mr. Chairman.
No.
Mr. Chairman, no.
Clerk report total.
3 yeas, 7 nays.
The amendment's not agreed to, not agreed to. For amendment or discussion.
Yes, Mr. Chairman,
Distinguished
I
gentleman
ask
from
unanimous
Florida.
consent to include in the record the testimony of Congressman Danny Davis in support of the Davis-Gallagher amendment and supporting list of organizations.
Without objection.
All right, thank you, Mr. Chairman. Mr. Chairman?
Yes, sir.
I have an amendment to the rule, and I move the committee make an order and give the necessary waivers for the amendment offered by Representative Waters to H.R. 5797, number 9, which requires states to expand Medicaid pursuant to the Affordable Care Act as a condition for using Medicaid funds to treat people with opioid abuse disorders in institutions for mental disease. And, Mr. Chairman, very briefly, I believe this is a germane amendment, and I raised the issue with Mr. Walden and Mr. Pallone of a state like mine where we did not expand Medicaid, and I have high incidence of opioid overdoses in the area that I serve. And they both gave real good responses, but I believe this amendment would help considerably address that subject for a state like mine that didn't expand Medicaid.
Thank you very much. Further discussion? Those in favor of the amendment from the distinguished gentleman from Florida, those in favor signify by saying aye.
Aye.
Those opposed, no. No.
Mr. Chairman, I ask for.
Gentlemen, that's for a roll call vote. Clerk will poll the committee.
Mr. Cole, Mr. Woodall. Mr. Woodall, no. Mr. Burgess. Mr. Burgess, no. Mr. Collins, Mr. Byrne. Mr. Byrne, no. Mr. Newhouse. Mr. Newhouse, no. Mr. Buck. Mr. Buck, no. Ms. Cheney. Ms. Cheney, no. Mr. McGovern. Mr. McGovern.
Aye.
Mr. McGovern, aye. Mr. Hastings. Aye. Mr. Hastings, aye. Mr. Polis. Mrs. Torres. Mrs. Torres, aye. Mr. Chairman.
No.
Mr. Chairman, no.
Clerk report total.
3 yeas, 7 nays.
The amendment's not agreed to. For amendment or discussion, seeing none, the vote now be on the motion from the distinguished gentleman from Georgia. Those in favor signify by saying aye. Aye. Those opposed, no.
No.
Ayes have it, ayes have it.
We have a roll call?
Gentlemen, that's a roll call vote. Clerk will hold the committee.
Mr. Cole, Mr. Woodall. Aye. Mr. Woodall, aye. Mr. Burgess. Mr. Burgess, aye. Mr. Collins. Mr. Byrne. Mr. Byrne, aye. Mr. Newhouse. Mr. Newhouse, aye. Mr. Buck. Mr. Buck, aye. Ms. Cheney. Ms. Cheney, aye. Mr. McGovern.
No.
Mr. McGovern, no. Mr. Hastings.
No.
Mr. Hastings, no. Mr. Polis. Mrs. Torres. Mrs. Torres, no. Mr. Chairman.
Aye.
Mr. Chairman, aye.
Clerk report total.
7 yeas, 3 nays.
The motion is agreed to according to the gentleman, distinguished gentleman from the Rules Committee. The gentleman, Dr. Burgess, will be handling this for Republicans.
And the distinguished gentleman from Massachusetts, me. will be
And that would be
handling
Mr.
Democrats.
McGovern. Now, thank you very much. Now, before we go too far, do you have anything to report in case Lisa's watching?
She's not watching.
Oh, well, we'll say, we'll just say,
I
oh,
got
she's
a-
across
yeah,
the
she's-
street.
yeah, so I'm
Okay,
gonna-
well, we want to say happy birthday to you then, Jim, on behalf of Lisa, so.
It's
best
not my
of luck.
birthday, it's my wife's birthday.
Right, that's what I meant, but, you know, you ought to celebrate. Well, she gets it's today's kiss day.
Mr. Chairman, what are we doing for the rest of the week?
You're trying to help out. So here's the bottom line. We do not have anything scheduled, but it's early in the week. So I would provide enough notice for us.
And just assuming that, I mean, there's a rumor out there that you're trying to bring up an immigration bill.
There is.
Right. So will there be a notice for amendments? I mean, will you be entertaining amendments, or are we just going to come up and kind of ram something onto the floor?
I would say first we're going to post the bill.
Okay.
Haven't posted the bill yet. Got to post the bill.
Do we think, but are we anticipating an amendment process, or Should we be getting our amendments ready just in case, or?
Well, I don't know that I have to talk anybody into it, but I would just say, without quoting anybody, but a good number of people said, if you address the issue and you have a fair opportunity for people, we will be for it. And that's what I'm hoping that will happen, is that people will see where we have tackled a difficult subject and may not be perfect, but by golly, we came pretty darn close. My point was, I did not speak for or against anybody, but I have heard lots of discussion for many years, including conversations I've had with people in this committee, and I am enormously proud if we're able to post this. So, would you want to offer amendments? I would, if you want to do that. I don't want to certainly talk anybody out of it, but my point is, I've heard most people in this body say, if you have a fair bill, good for you.
Well, you know, Mr. Chairman, repeatedly the president says that Democrats need to come to the table. I wouldn't mind going to the table if I knew where the table was and when people were setting the table.
Yes, sir.
But under the circumstances, the way that we are proceeding, we're not in that process. And I'm not talking about Pelosi, Schumer, McConnell, the upper tier. I'm talking about rank and file people here who have a lot to contribute to a very complex problem, that all of us understand that particular dynamic. So yes, I do wish to offer an amendment. It probably would not be made in order, may not even be germane, but it should be a right of mine to do so. And I personally resent the president continuing to say that the problems that exist are because of Democrats. There have been other presidents, Democrat and Republican, that have not been able to meet this extremely complex problem. And I don't believe you're going to present anything that's going to be curative. And it's deeply disturbing that we don't have 435 people here plus 6 and 100 over on the other side locked up here until we solve what we know is a critical problem in this nation. It ain't right.
Yes, sir. Well, I got to ask a question. I gave my response, so did you. And what I would suggest to you is we're going to post that language here pretty quickly. When we do, then you're entitled to your opinion again.
Yeah, if I could, I just want to direct to reflect, I did try to get to the table today. A few of us tried to get into your meeting with the president, but we were not allowed in. And then I tried to get the president's attention to show him some of the pictures that he apparently hasn't seen about the separation of children at the border, and so we were kind of put to one side. So I don't know if he could hear me because I was screaming, but he couldn't. I'm not sure he didn't take the time to look at the pictures. So we tried.
Did he say tell Lisa happy birthday?
He did not, but.
Well, we're going to get a shot at this as soon as that gets posted. Then we'll understand more about it. And I would like the distinguished gentleman from Florida to know this has been a lift for us, and I'm proud if we get it filed. I want to thank everybody in the committee for being here and for your assistance and for the great staff and our awesome stenographer. This completes our work for the day.